Hello, everyone, and welcome to episode 7 of #IGD Talks. My name is Raquel Simpson, and I will be your host today. Just to introduce myself, I am a practical nursing student, and I hold a master's in emergency management. I recently embarked upon this wonderful journey of gerontological nursing. In this podcast series, I will be introducing a number of special guests who will be providing invaluable insight in dementia care, dementia research, training, and education. Let's get started. Enjoy the show. Hello, everyone, and thank you so much for joining in to this episode number 7 of our podcast series. Today we have Peter Huang, and he is going to give us a very interesting perspective. Thank you for joining us, Peter.
Thanks for having me, Raquel. Is that how I pronounce it?
Raquel.
I'm Peter Huang. I'm a med student at McMaster. I'm going into my third year now. I'm a clerk.
Awesome. Great. Tell us a little bit about your experience in gerontology and geriatrics.
Honestly, I could always use more experience, but a lot of the patients that we do care for, I'm interested in internal medicine. A lot of them have been over the age of 65. Many of these patients have many complex issues and a lot of surrounding social factors as well. A bunch of them also have dementia, and these patients are a lot of time require a lot of thought process into getting the holistic picture and trying to manage them appropriately, giving their wishes and trying to make sure that the person in front of me comes first.
Right. That's so imperative. Tell us a little bit about your experience with GPA.
Sure. So I took the GPA course last year as a part of Geriatric Skills Day at McMaster, and I thought the course was great. The GP course is it gives me a very valuable approach to actually once again thinking about the holistic picture of a patient, especially like the PIECES framework, for example. So like when a patient, like a GPA essentially telling me to look about the behavioral and psychological symptoms of dementia or BPSD. And that GPA course essentially makes me take a step back and think about like what are the underlying reasons for their symptoms, because essentially it's a symptom.
Right.
They're not trying to be agitated. They're just like there's sometimes an unmet need that we kind of have to focus on and think about what can we do to actually to work around these issues and make the place more comfortable for the patient and, hopefully reduce their suffering.
That's great.
Yeah. So, I think the GPA course, having the approach and thinking about like, the ABCs, what was the behavior, what caused the behavior and how I can work around it is incredibly valuable for medical students.
Awesome. That's actually leading into my next question.
Oh, okay.
So I wanted to start off talking about your experience, but I also wanted you to kind of expand and talk about the significance and the relevance to other medical students as well.
Yeah, for sure. So as medical students, we're like at a very early stage in our training. A lot of us aren't sure what we want, and a lot of time when we're on the ward, there are things that like we're not comfortable with, we don't know much about, and BPSD has like definitely made me feel uncomfortable when I first saw it. It's uncomfortable to see a patient who's agitated in front of you. You always want to feel like, oh, I want to do something about this. I want to help them somehow.
Absolutely.
Like they really look like they're suffering. So in terms of for medical students, it's essentially care of the elderly, right? It doesn't necessarily have to be even geriatrics related. But it gives us, once again, that chance to, like, it's so multifactorial, BPSD, which is why I think it's super high yield for med students. Like, there's a biological perspective that you can treat with either removing medications or adding certain types of medications. There's psychological and social aspects where you'll ask family, what are these patients' wishes? What are the likes and dislikes? What makes this person uncomfortable? And all of these things are I think med students really like to do, I hope. And, just getting this big picture on the patient, we spend a lot of time with like professional competencies and like communication skills. And the GP course is essentially another way for us to incorporate communication skills into care of older adults.
Right. That's so good.
Yeah.
Awesome. So can you tell me a little bit about your experience when you did the GSD workshop?
Yeah, so the GSD workshop essentially runs every year. It's a little different box of chocolates. We always get something interesting. There's usually courses, like mini workshops run around elderly things, geriatric related things, obviously. And the one I remember most clearly are the ones from this year. And there was great stuff on like deprescribing medications, which is a huge thing for med students as well, because we're starting to learn our meds. We should not just learn how to give the meds, but how to take them away, especially in older adults who are, prone for polypharmacy, risk of falls, and just side effects of the medications in general, given that their physiology is different from someone who's younger. There were also courses like workshops on like personhood and just thinking about medicine. I feel is a lot about storytelling. Like these patients are telling you a story, and all you get is a snapshot of their life.
For sure.
So you kind of have to think about like what was the whole thing that was leading up to it, because really health is mostly social determinants of health, and it's all those things that you have to be picking up and trying to like do detective work and try to find out. And I think like GSD was like some of those workshops were things I definitely look back and I can actually remember and say, oh, right, I've learned this. I might not remember that I learned it here, but I'm trying to do the right things.
Absolutely. So there's some guiding principles that you are now applying within practice.
Yeah, absolutely.
That's awesome. Can you share maybe a personal example of where you clearly saw where your training of GPA came into play with a specific patient or in a specific clinical scenario?
Yeah, for sure. There was like a patient that when I was on the palliative care team, it's about an 80-year-old female, and she did have a diagnosis of dementia. And she was coming in she had multiple comorbidities. And then afterwards, when she came into hospital, it was just her poor physiologic reserve and having multiple medical issues. It made it very difficult for her to bounce back. And because of that, she was admitted to the palliative care ward, because the family, and in incorporating the patient's wishes as well, wanted to have like a peaceful death, essentially, and dying with dignity. So this patient, although she wasn't speaking words to us anymore, and a lot of times she was lying in bed. There were times where she actually looked uncomfortable, and she would look. She appeared agitated, and the family would always be concerned as well, because they're the ones who are right there with her all the time. And there would definitely be times where she wouldn't even be able to sleep very well. And that like when you're reaching everyone loves sleep anyways, but you want to make sure it's as comfortable as possible for these patients. So what I actually remember doing is like, once again, taking that step back and saying, well, this person's exhibiting these symptoms, which are like agitation, poor sleep, and I should try to find out why they are having these symptoms. So we found out that she was constipated for several days, which we treated accordingly. She was just in pain from lying in bed, but because she was bedbound for so long, so we kind of treated the pain for that, and just to make sure that some shortness of breath as well that she was having, again, because of her multiple comorbidities. And those ones could be treated with like medical stuff, but it was actually just having her family around and holding her hand that a lot of the time actually just like seemed to calm her. And it was actually incredible to see it, because it's like a mother and her daughter, and they're just like, they're peaceful, and they know that, like, I know she knows that her daughter still cares very deeply for her. Absolutely. And just wants the best. And for sure, those moments, like, they're super powerful to just observe and watch the love between them. Yeah.
That's awesome. Can you share another instance where just some of the GPA training and you had mentioned personhood, and I think the previous example that you shared speaks a lot to personhood and understanding the family dynamics, the relationships that the person had, maybe even prior to their diagnosis, and how that plays a role in bringing comfort, especially in the setting of palliative care. Is there another example that you can think of that really where you saw where your GPA training really came into play and aiding you in working with a specific patient with dementia?
Yeah. So another example I would have would be like or GPA specifically. So they encourage those non-pharmacological and then pharmacological management. I've been very fortunate not to have to have any situations where I've actually had to protect myself for anything like that. A lot of it has been, the symptoms of agitation or discomfort. And one of them that I did find when I asked the family, once again, it was a patient who was nearing the end of their life, was asking the family, like, what is this? Tell me more about this patient. Like, what was she like as a mother? What were her likes and dislikes? And the daughter was like, she really likes a certain type of Spanish music. I was like, okay, why don't we try playing the Spanish music for her? And that seemed to calm her down, and it made the mother more comfortable. And I'd say that came from the GPA approach because you're kind of looking into, what are the patient's wishes, and what part of the piece is framework. I guess in this case it'd be like intellectual, emotional, and then the social part of just having your daughter around, where I can directly apply. Oh, this patient likes music therapy, and this patient likes having people around, just being with her. Yeah.
That's awesome. So, do you have any words of wisdom for maybe some of your those who are in the same discipline as you, so other medical students or residents who might be wavering or considering whether or not to take part in GPA training? Do you have any words of wisdom or nuggets of truth to kind of share?
I think it's like we learn in medicine that, it's like learn the physiology, then learn the pathology, and then learn the treatment to it. And I think there's still truth to BPSD and applying GPA, and they're all just like a spectrum of different things. And a lot of time, like we feel like nervous, or like how do we manage these things? Like managing, mental health is something that can make students uncomfortable. It can definitely make me uncomfortable as well. And just having that extra step of training is super useful. So I guess like the tidbit I'd say is like, BPSD, it's in the name. It's a symptom. Like you should be taking a step back and looking at who is this patient? What's their story? What can I do to make this person more comfortable? Make like, because a lot of the time I've been in hospital for my rotations. Like, how can I make the hospital a home for this patient as well? And if you take the step back and say, like, this person's not trying to act this way. I would act the same way if I couldn't speak for myself. And if you keep that in mind, I think it's super helpful to med students to like think that people aren't trying to do bad things. They just have something there that you have to do the detective work.
They have a cognitive impairment.
Yeah. And it's your job to try to find out why and help them out through it.
Right. And these are all principles that GPA training can offer.
Yeah, absolutely. Yeah.
Great. For our viewers and for our audience, the modules that Peter is making mention of is actually found in the GPA participant manual that consists of 4 modules, and each module is definitely evidence informed, and it's here to really equip participants to feel empowered and to feel equipped when working with persons living with dementia. So if you're interested in accessing this manual, it's definitely something that you can find at www.age.inc. Thank you so much for your time, Peter.
Great.
It was awesome speaking with you, and it was great getting that medical student perspective.
Yeah.
So thank you so much.
Yeah, thanks for having me.
And that concludes episode 7 of #IGD Talks. Thank you so much for tuning in. Be sure to join us for episode 8 with Dr. Lori Schindel-Martin, an associate professor at the Daphne Cockwell School of Nursing at Ryerson University. She is also one of the lead investigators on a study about geriatrics, behavior and dementia in education. She is also the producer of this podcast series, and I'll be speaking with her about the importance of understanding BPSD and GPA.